COVID-19.
India kickstarts the second phase of the COVID-19 vaccination drive, which covers everyone above 60 years and those above 45 years with comorbidities. Prime Minister Modi gets his first COVID vaccine shot at the AIIMS in New Delhi. Private hospitals start administering doses of the coronavirus vaccines, even as technical issues on the CoWIN platform delay inoculations at some centres. Vaccine makers express concerns about the 150 rupee per dose cap. Markets recover after the sharp sell-off on Friday. The Sensex moves closer to 50,000. The Nifty gains over 200 points. Mid-caps and banks also rally. Auctions begin for over 2,200 megahertz of 4G telecom spectrum across 7 bands. The 3 big telecom companies, Jio, Airtel and Vodafone Idea, are in the race, with Jio's earnest money deposits at 10,000 crore rupees, followed by Airtel at 3,000 crores and 475 crores for Vodafone Idea. Prime Minister Modi to hold a brainstorming session with industry leaders on India's production-linked incentive schemes on the 5th of March. Sources say 42 industry heads have been invited for the webinar. That's a CNBC TV 18 exclusive. Auto sales continue to throw up a mixed picture. Maruti and Tata Motors largely meet expectations in February, but Bajaj Auto, TVS, M&M below estimates. Chinese hackers may have targeted power facilities in India last year and could even be behind the outage in Mumbai in October, according to a New York Times report. A US-based company called Recorded Future claims that China may have planted malware across India's power plants. Former US President Donald Trump hints at running for the White House in 2024 at a conservative conference, terms President Biden's first month in office as the most disastrous in history. Nomadland wins the top honours at the partially virtual Golden Globe ceremony, marred by spotty Wi-Fi and Zoom chaos. The late Chadwick Boseman wins Best Actor. The jury comes under fire as no black person was part of the 87-member group. Well, this is the big story today. The second phase of India's vaccination drive has kicked off. Starting today, more than 10,000 private hospitals across India can administer the COVID-19 vaccine. People over 60 years of age and those above 45 years, but with specific comorbidities, are eligible for vaccination in this phase. Prime Minister Modi took his first COVID vaccine shot at the AIIMS hospital in New Delhi. The Prime Minister was administered a shot of Bharat Biotech's Covaxin. Many centres have seen long queues of people waiting for the vaccine, with many reporting technical glitches on the CoWIN app. The centre has also imposed a price cap on the vaccines administered by private hospital. The price of a vaccine dose has been capped at 150 rupees, with an additional service charge of 100 rupees. So all in all, a private hospital cannot charge citizens over 250 rupees for a single COVID vaccine dose. Vaccines will continue to be administered free of cost at government hospitals. Well, here's how day one of the vaccination drive panned out across the country.
I'm here at Max Hospital, Saket, where people are quite enthusiastic to get their first jab done. A lot of people are coming after doing registration at home through the app. A lot of people are walking in. We have a beneficiary here, Mr. Mattu. Sir, did you try to register through the app at home?
I did it through app also, but that didn't work. It was not showing up in their software. So I stood in the walk-in line, and then they did it themselves. And that's how I got this number.
So you got registered over here, you tried at home, but the app did not work.
That didn't. Their software didn't show. So they tried it. They were quite cooperative that way.
Well, the second phase of the vaccination drive is underway here in Bangalore, and across Karnataka there are more than 250 health centers which are vaccinating senior citizens and people with comorbidities above 45 years of age as part of the second vaccination drive. I'm here at Narayana Health City, where, as you can see behind me, several senior citizens have come down since morning to get the Covishield vaccination, which is available here at Narayana Health City. Let's check in with what's really bringing a lot of the senior citizens to come forward and take the jab. A lot of people have come down here. The process has been smooth, more or less. There have been technical glitches with the CoWIN 2.0 platform. We did talk to several people who had come down here who had to re-register or register, on the spot here.
Well, I'm at Apollo Hospital's vaccination site in Chennai, where the major expects to vaccinate 615 people on the first day of the second phase of vaccination itself. And despite there being glitches with the CoWIN app in its 2.0 version, what you are seeing essentially are, vaccination officials recording details manually and uploading it onto the app a little later on, even as the vaccination process we hear has been going on smoothly despite these glitches. As you can see, a number of people have made it to the vaccination center, where the hospital hopes to vaccinate a large number of them. Remember, in all, 587 private hospitals and 618 government hospitals will be active throughout phase 2 of the vaccination itself. In the vaccine room, as you can see, patients and vaccine candidates rather get to a spot where they are vaccinated here. Remember, 615 is the number for the day as far as Apollo hospitals are concerned, even as the Tamil Nadu government hopes that phase 2 of the vaccination will deliver more results when compared to phase 1 itself.
Well, CNBC TV18's team of reporters on the ground getting you the latest updates. Let's go close to my colleague Archana Shukla. She joins us from Mumbai. She's at the government's jumbo facility at the Bandra Kurla complex. Archana, I can see lots of people behind you waiting to get their shot. Take us through what you are experiencing on ground there.
Well, there is a huge crowd outside the BKC Jumbo facility, and this has been the situation since morning here in BKC. Remember, in Mumbai, only 8 centers, 5 jumbo facilities run by the government, and 3 private centers have been allowed to take walk-in for senior citizens and people of the age of 45 with comorbidities. But because the CoWIN app was facing technical glitches in the morning, the process was pretty slow. It was halted. It was only after 12 o'clock that the process of registration started. And remember, this is the center that will also get the frontline workers and healthcare workers also their second dose or the first dose as per the registration. And because of the glitches in the CoWIN app and a lot of walk-ins of senior citizens on day 1 itself, there has been a huge crowd and waiting outside. People have been waiting for 2-3 hours to get their registration. Those who could manage to register on the cowin.gov.in still had to just wait for an hour or 2, but the others have waited for 3-4 hours. Right now, the registration for general people over here has been stopped. You can see the crowd. Even the frontline workers and healthcare workers have been waiting, who are registered to take their second dose today, have been waiting for a long time. And this issue is not particularly, of the CoWIN app. That certainly delayed the process. But the issue has been that a lot of people have walked in today on day 1. And since there are very few centers in Mumbai who are doing the vaccination shots, you're seeing this sort of mismanagement. Once they move inside after their registration and take their shot, that process is still much smoother, is what people have told us that we spoke to in the day. Back to you.
Well, thanks very much. Yes, that is a challenge that a lot of centers are reporting walk-ins, and this is going to be a crowd management exercise. Archana, stay safe. I don't see any social distancing in that center at BKC behind you. So thanks very much for joining us. Let me bring in our guest, Sunita Reddy, the Managing Director of Apollo Hospitals with us. Also with us, Viren Shetty, the Executive Director and Group Chief Operating Officer of Narayana Health. Ashutosh Raghuvanshi, the Managing Director and CEO of Fortis Healthcare. Sunita and gentlemen, many thanks for joining us here on CNBC TV18. Sunita, let me come to you first. As my colleague Archana was reporting, and we've of course had our team of reporters out at different private healthcare facilities, including at the Apollo Hospital in Chennai. The problem seems to be one of issues with the app. But more importantly, how do you manage the walk-ins that are coming into the hospital, given the fact that today is day 1 and clearly there is a lot of pent-up demand for the vaccine?
So yes, day 1 is always a difficult day because the app was launched this morning, so it will take a little time for everyone to understand the utilization and for it to take the load. But having said that, I think, things will smooth out because we have people at the center who are helping people upload their details. And with this, we think it will smooth out. We have 95 centers at Apollo. So there are a large number of centers, and there will be pent-up demand in the first day because I think people are anxious. Plus, it's also people, like they said earlier, healthcare workers getting their second dose of the vaccine. But if you think about it, in the next 2 to 3 weeks, the numbers it'll smoothen out. The whole process will smoothen out. And this is because, we are opening more centers. Hopefully they'll give us the ability to move from just 8 hours a day to, more than 12 to 14 hours, in which we can help schedule much better and therefore, reduce the waiting time. I think the third thing is that people are forgetting that social distancing and wearing a mask is very, very important at this time. So we have opened up helplines where people can call and fix a time where they'll come. I hope people will continue to use that because there is an Apollo 24/7 helpline that's open 24 hours a day, and they should use this to schedule their appointments.
Sunita, I just wanted to get a clarification from you. You said that 95 centers are eligible to give out the vaccination, to inoculate people as part of the centers that the government has identified. But you also said that you're only being able to administer vaccines for 8 hours a day. Is that a government mandate? And also, if you can share with us, what is the kind of supply that's been provided to the Apollo group of hospitals, to these 95 centers? So how many people can you vaccinate in each of your hospitals every day?
So it changes from state to state. So you have to understand that healthcare is a state subject. So definitely it changes from state to state. We have 95 centers within Apollo, which we are using. The current protocol is to do it for 8 hours, but we hope to speak to the government to enhance it to 12 hours. So that, this waiting time will be reduced and we'll be able to vaccinate many more people. Each state decides how many vaccines will be given at each hospital. For example, in Chennai today, we got 650 vaccines. So we're able to do 650 in Chennai. In Delhi, for example, we've got 2,000. So it's like I said, it's a state subject. It varies from state to state. But we hope that thinking about opening up the working hours is something that they would consider because the private sector is ready to work with the central government and with the state governments to ensure a smooth vaccination program.
Yes, so you're saying that relax the shift timing, so go beyond 8 hours so that the waiting time is reduced, and you're also hoping that supplies will be increased. So in Chennai today, you've done about 615 vaccinations or given out 615 doses, and in Delhi, you're saying it's about 1,000. Viren Shetty, thanks very much for joining us. Take me through what day one has been like at the Narayana Health. You've had a lot of, I could see people like Chris Gopalakrishnan and many others, of course, at your centers this morning getting vaccinated. Have you also had a problem managing crowds with the walk-ins being higher than those who are registered on the app?
No, not at all. In fact, our hospitals are designed to manage much more than the crowds that come for vaccine. It will develop, as Sunita mentioned earlier. Right now, there are some issues with patients logging in. People really don't know how to access it, and it's quite inaccessible for people that are tech illiterate. And we're working on workarounds that allow people to call and block the appointments in advance so that we can do crowd management much better. We're all hoping and praying that these things will sort themselves out with time. And as soon as we get a much better handle on this, we should be able to scale up quite rapidly. But of course, there's still a lot of changes we wish the government would allow. So for example, Chris Gopalakrishnan did mention that, they represent a huge number of associations of industries who would like to have vaccinations done for all their staff. And right now, the protocol only indicates that you can vaccinate within a hospital. But in most parts of the world, the Western world included, vaccination is done outdoors. It's done in a drive-through system. They're campus vaccinations. We should be open-minded enough to allow that.
Yeah. So that's one of the changes that industries are asking for, and private hospitals are also asking for. Perhaps that's something that the government may allow in the next phase. But Viren, I just wanted to understand what kind of supplies have been provided to you. What's the quantum that you're going to be able to inoculate on a daily basis?
As much as we can get. The supplies are the vaccine dose, which is given to us by the government.
How much have you got?
Across every hospital, anywhere from 100 to 200 doses, but it's barely enough. I mean, we could easily
That's it,
process
100 to
thousands
200 doses across all of your hospitals.
per hospital. Per hospital, we could easily do a lot more than that.
So cumulatively, how much would that be? To the Narayana Health Group, how many doses would that mean today?
As and when we finish it, we'll get more. The question is the regularity of the supply. So if we were able to, for example, place an order directly with Serum Institute, we would order 10 lakh doses. And that's something that would come to us with much more regularity. But right now, there's still a lot more demand than there is supply for the vaccine. And so the government is doing their best, their hardest to ration it out among different providers. And we're very grateful for the support we've gotten from them. But of course, we can always do more.
Yes, and that clearly seems to be the case, as we heard there from Sunita Reddy as well, that the demand is much higher than the supplies that have currently been provided to private hospitals. The expectation is that perhaps this will increase because currently what we're given to understand, the government is working with the stockpile that it already has. They haven't purchased new supplies from either Bharat Biotech or Serum, and maybe the supply will enhance as and when that happens. But Dr. Raghuvanshi, many thanks for joining us. Take me through what the experience has been like at Fortis Healthcare. How have you been able to cope with day one? How many vaccinations have been administered today?
So our experience has been pretty similar of what Sunita and Viren said. We have inoculated about 1,000 people today, and the supply was different in different states. Some states are giving a supply for a week, and the others are giving on a daily basis. Currently, what has been promised and what has been told is probably not adequate for the demand we are seeing. We were expecting that there will be a lot of hesitancy in patients' mind, people's mind for coming for vaccine, but that's not the case. And some minor glitches in terms of the app, etc., have been there. But other than that, this process has run quite smoothly. And the supplies also have been very, very efficient from the government side. And it's actually quite impressive how the system has been put in place. So I expect that as the time goes by and these teething troubles are sorted out in the next couple of days, this could be ramped up much larger. And I do agree that this probably we need to have much more centers outside of hospital settings as well in order to fulfill the demand which is going to be there in the next few days.
Dr. Raghuvanshi, you said that, in some centers you're being given supply for a week. In some centers it's going to be on a daily basis. Two questions to you. What is the impact of this on the rest of your operations? Because I would imagine perhaps over the next few days, the walk-ins will start to thin out. But, if the walk-ins continue to be the same pace at which we've seen them today, then that would perhaps impact operations, non-COVID operations. Have you seen that happen today? And I also wanted to get each one of you to comment on the price cap of 250 rupees. It's a 100 rupee service charge that hospitals are being allowed to charge, and 150 price cap for the vaccine maker. What do you make of that?
So operationally, we haven't seen a challenge because most of our hospitals are large enough to have handled this kind of volumes. We have made separate exits and entry points in order to make sure that there is no confusion in the routine care. So that part has been going on well. As far as price control is concerned, we don't look at it as a commercial opportunity. So as long as our costs is covered, we are all right with that. However, the price cap on the vaccine manufacturers, that probably is an issue on which we can't directly come.
Yes, that is something that I would imagine the vaccine manufacturers will take up with the government. They have already had conversations with the government about that. But Sunita, and it's very clear, I don't think anyone is suggesting that this is going to be being seen as a profit-making revenue stream at this point in time. But the 100 rupees administration charge, does that cover costs for you as a hospital? And what do you make of the 150 rupee price cap as far as the vaccine dose is concerned?
I think I think it's both the pharmaceutical company that's making the vaccine as well as the providers are just coming together to do something good for society. So we are not making money. It's just we are covering costs. I can't really comment on the pharmaceutical companies, but I think that they will be able to subsidize their costs by selling it commercially at some time. So clearly, I don't think it's anyone's going to make a loss. The whole country is going to gain, and our patients are going to gain. So, I think right now cost is not the issue. When they move to corporates, and if they allow the corporates to allow vaccination as CSR funding, then I think, it'll be a very good time to really use corporates to ramp up vaccinations, because the only way we can achieve herd immunity is to make sure that a large population is covered. And currently what we're doing now at Apollo, we do about across the system about 13,500 vaccinations a day, whereas we can do 1 million doses, and we've trained about 7,000 people to give the vaccinations. So I think the potential, we have the potential to do so much more. We're not looking at it from a profit perspective, but I think this is a collaboration opportunity between the government, the companies, the corporates, as well as the private healthcare sector.
Yes, it is a collaboration, and each stakeholder is trying to do whatever is possible. Viren, let me ask you, 100 rupees in terms of administration charges, that cover costs for you? And is there an indication now on how many people have signed up to be at your centers tomorrow for the inoculation?
100 rupees can cover your direct cost. It will not cover all the other costs, opportunity cost, overhead, salaries, none of that. But in terms of actual expenses, your gloves, the syringe, all of that, that's fine. It may not cover the cost of the nurse's time, but this is our contribution to the nation, so it should not be a problem. The other question is, what is the interest that's been garnered? The slots are filling up. What we are trying to do from our side is to create a parallel booking system so that we can at least batch people in large numbers, so that if they have any trouble with the app, we could do the manual entry for them. And so that is something that should get more streamlined. But the capacity can theoretically go up to thousands of people per day for each of our hospitals.
Yes, the capacity can go up to 1,000 plus people, but at this point in time, that's not the kind of supply that's available with hospitals. But Dr. Raghuvanshi, let me give you the final say. Are you also working on a system like a parallel booking system that Viren just spoke to us about, to ensure that there are, not long queues, or you don't have people waiting for long before they get inoculated?
Yeah, so we have also created a call center as well as a parallel booking system through our app, so that people don't have to wait for too long. But that's that's something which is going to get streamlined over the next few days as we have more centers coming online. We'll have a capacity of close to about
Sunita, yeah. Go ahead, sir. Sorry, how much per day?
So currently what the supply has been given, that is about 1,400 per day. But as both of them said, that we could do much, much more than that. We could do 10 times of that. So 1,400 is too small a number.
Yes, it is a smaller number for a hospital chain your size, and the hope and the expectation is that as supplies are ramped up, the government will provide more to the private sector as far as this phase of the vaccination drive is concerned. But Sunita Reddy, Viren and Dr. Raghuvanshi, we wish you the very best of luck. Thank you so much for joining us to take us through the experience on day one, and more importantly, the kind of systems that each one of you is putting in place to ensure that this is a smooth process for all involved. That's a wrap, but we leave you with Nurse Niveda, who works at the All India Institute of Medical Sciences in Delhi. She was the one who vaccinated the Prime Minister this morning. Thanks for watching.
It was a wonderful opportunity to meet the PM of the nation today. I vaccinated sir in the morning. Bharat Biotech ka Covaxin. That's the first dose he has taken today. He inquired how are we. There was one more sister with me, Rosamma Anil. He spoke to us very normally. It was very plain. We weren't scared, and we are talking to the Prime Minister.